Uh, Dr. Sharad Agarwal, IMA National President, is here with us. So, sir, we welcome you on 10 News Network. So, first of all, Happy Doctors Day. And medicine is always considered to be the noblest of all professions. So, sir, first of all, kindly explain the significance of Doctors Day. Why Doctors Day is celebrated every year?
See, Doctors' Day is celebrated on the remembering our dynamic leader, Dr. B.C. Rai, who's born on 1st July and took last breath on 1st July. And that history everybody knows. More important is that we wanted to uh, give to the society, which we are doing it for years. We have started this the 2 weeks program. We started on 25th of June with the relaunch of our Gaon Chale program by the hand of our chief patron, our leader, Dr. Ketan Desai sir at Gandhinagar. And we have did 800 blaze services on the same day. That you can understand the magnitude of IMA. We have 1700 branches, and we have asked all the branches to adopt a one village and start doing regular activities, not a one single time activity, and do a job on the prevention. So 800 blazes we have already taken, and we relaunched the Agarwal Chale. Rest of the 900 blazes soon we will take in. And now we have started this 7 days week program of on the blood donation camp and blood donation awareness. That is
So,
very important.
so IMA came into being in the year 1928. So, all these years, what have been the major accomplishments and what is the roadmap ahead? What are the ambitious plans in the pipeline?
See, you can understand an association in India which is conceived pre-independence and still stand with laurel and proud. So you can understand there is a huge things too. If I will start telling you what we have done, it will take at least 24 hours. But to just short you, I'll just mention few landmarks. When HIV/AIDS was there in India in late 90s or early 2000, that decade, everybody, even the physicians were scared of touching the patient. Indian Medical Association took the initiative that time without support of government, and we trained our doctors, we sensitized our doctor how to treat a HIV/AIDS patient, and you can see what is the impact. Now there is no fear. The TV initiative started by the Indian Medical Association. Again, it is no support from the government, but Indian Medical Association took this initiative, the responsibility for the TV. And if you know that our beloved Prime Minister, he declared initially that TV elimination by 2030. But because of the effort of the IMA and the contribution of doctors, member of IMA, now we are thinking to eliminate in 2025. And COVID, you see, latest example, entire world appraised the COVID management of India. Who do this? It is the member of Indian Medical Association, doctors and the healthcare worker who put their life on the risk, and we lost 2000 doctors by serving COVID.
So, how is the World Medical Association recognizing and hailing the efforts, the initiatives, the accomplishments of Indian Medical Association?
See, World Medical Association know this, and they accomplish and they understand and they recognize the value of Indian Medical Association. Our chief patron, Dr. Ketan Desai, was the president of World Medical Association once upon a time. Our another doctor was the treasurer of that association, and right now I am the council member of WMA, and they take our voice very seriously.
So, when we talk about challenges, don't you think that the time is ripe when the central government has to focus on vandalism, the attacks on doctors? So, what is the IMA doing in this regard?
IMA is doing its service for which we have been trained. We are trained for doing the job for the society, for the community, with the healing touch. I am happy that you are raising this voice. I am thankful to you. If all the media will take that initiative to sensitize the society that doctors are doctors, they are not insurer. So you cannot expect every time a positive result, because we have to accept the death. Death is the destiny. It is not the result. So I am very happy. Please take this, and we need to sensitize the society that if you put the vandalism, if you do the violence with the doctor, there will be a day when doctors will refusing the critical patient and they will referring it to the government hospital. You think about that situation, what will happen? So please stop violence. It is not acceptable. Hospital should be declared safe zone.
So, what about these myths? How can these myths regarding organ donation be busted? How can more awareness be created amongst the masses to donate their organs?
organ donation again is a noble cause, and there is a huge gap between the demand and the supply, because the general public, they don't know. Actually, there has to be some gap analysis. Even those people who want to donate their organ, they don't know where to go, whom to talk. IMA, Indian Medical Association headquarters, taken up with this initiative under the visionary leader of Dr. Ketan Desai. We are launching our pledge and the card on the World Organ Donation Day, that is on 3rd August, and we are organizing a mammoth walkathon just to aware the society, and it will happen again in our 1700 branches across the country.
So, sir, final one question. So, what is the message to the youths of the country, and especially on such a momentous occasion, Doctors' Day, and this grand blood donation camp which has been organized here?
The message for the youth is very simple. Please become a good human being. Rest is absolutely depends on everybody's choice. But if you are a good human being, everything is common to that.
Perfect, sir. Sir, one last. I cannot resist to ask you the age long confrontation. Because the modern medicine system does not accept the Ayush. I mean, in the sense, the Ayurveda, the Siddhi, the Unani practices. So, what do you have to say regarding that?
I don't think whether we have ever said that we are not, we, who are we to accept them? They are
No,
there.
because you basically emphasize on evidence based.
No, I tell you. See, as a Indian Medical Association, I am again reverbalizing my statement. We respect all the pathies, but we want the purity of pathy. Our request is, don't do the cross pathy. If I am not trained in Ayurveda and homeopathy, I have no right to prescribe their medicine. Likewise, if they are not trained in the modern medicine, they should not prescribe them. That is the only thing. Because the people with the malified intention, they distorted this statement, and they put we all just against each other. We are not against each other. We want their system should be improved. We want government should increase more and more Ayush medical college. We want government should increase more and more staff and infrastructure and start some research work there. Because modern medicine is the evidence based. They should also do some research and prove that whatever medicine they are prescribing, it is effective. That is the only thing.
So, how will you cope up with quackery?
Quackery is like any crime in India, and government is responsible and the administration is responsible. It is
So,
their
what will
job.
IMA do in this regard?
See, it is not our job. See, if crime is there in the country, it is the government and the administrative job. We are doing our job. If you have
So, whistleblowers, as whistleblowers.
no, why should we whistleblow?
Okay.
All the local administration, they know how many quacks are working under them. Can you understand?
But that's a burning issue.
See, it is immaterial for us, because if I am capable doctor, patient will automatically come to me. Patients are coming to me by the value of their treatment, not because of my advertisement. So if I am a worthy doctor, patients are coming. I don't care of these quacks and all.
Sir, one last thing. I'm sorry I'm extending this interaction. But really I want the viewers to know more. Recent ICMR study is very alarming. They say that the number of diabetes cases which are on the rise. Do you think, first of all, what needs to be done? And secondly, do you think the day is not far when India would be on the threshold of becoming the diabetes capital of the world?
It is already. It is already, and because of in the last 2 decades, the daily pursuit and daily culture change in India lead us to the non-communicable disease. Initially, if you say 2 decades before, we were the more in the communicable disease, infective disease oriented. The maximum disease are with the infection disease. Now the maximum load of the illness is non-communicable disease like hypertension, cardiac disease, diabetes. These kind of things are happening. Kidney disease. It is all because of the change of lifestyle. Maximum use of the junk food, no exercise, no habit, just on the computer and the TV screen. The kids are just wasting their time in the room. There is hardly any outdoor play. So we have to change our lifestyle. We have to come back to the basics, do the yoga, do some sports, play some sports outside the room, and have a good food.
Excellent. So that was Dr. Sharad Agarwal, and sir imparted us a lot of information. Thank you.